So I was talking to a good friend at the gym, and we were talking about NAD, nicotinamide adenine dinucleotide or mononucleotide. These are become quite popular out there in the markets for metabolism, energy, cognitive, the brain, addiction medicine. So just this is just more of a bit of a reminder. So the use of this basically it's like a B vitamin B3 precursors is not new. It's been around for probably since the 50s. There was a group of physicians called orthomolecular doctors, psychiatrists, where they were using like niacinamide in for mental health, schizophrenia. There was a well-known pioneer locally here in British Columbia, Dr. Abram Hoffer, who practiced like till his 90s. And so there's groups of these people that are now unfortunately have all passed away. But I was lucky enough to kind of know them and spend a bit of time with them. And so when I'm seeing all this like new interest in like the use of NAD, I guess this is just a voice to say, remember the basic ones. So niacin is it makes NAD, and niacinamide, or the other name for niacinamide is nicotinamide, also makes NAD. So you take niacinamide, for example, and your NAD levels will go up. And what's the other part is that they're really cheap too. So as a consequence, what I'm finding is that you're not even finding them even on the markets as much anymore because they're kind of so basic and simple. Not to say that the NADs products out there, NADR, the NMN as an example, all these precursor ones are bad. But again, just remember that these basic ones are equally as important. So for example, that's what I take. So I take niacinamide. And the reason why some of the differences, like niacin is famous for cholesterol, those lipid profiles, and it can make you flush. So that's obviously an uncomfortable thing, a tricky thing for people that don't know, versus niacinamide doesn't flush. So or nicotinamide, it does not flush. So they kind of work slightly differently, but from an NAD perspective, they up the levels. So there's papers showing that. So again, don't forget about niacinamide. It's what's also where it's being talked about a lot recently is like for skin cancers. So in non-melanoma skin cancers, so like say squamous cell, basal cell, actinic keratosis, there's talk of maybe this niacinamide helping to decrease the risk of these things from coming back. Again, the literature is being debated on it. However, it's for the doses that's being recommended, like say about 500 milligrams twice a day, roughly. It seems like a pretty like safe dose. And as an example, so anyways, just to kind of talk about, remember the basics, niacin and niacinamide or nicotinamide, that those are kind of cost-effective ways of upping the NAD levels in the body and all the great things that this B vitamin does.